have always felt this way, that cats are the neglected stepchildren in oncology.
Yeah.
There's less cancer, but I feel like in the last 5 years, there's been maybe not an explosion, but there's been so many diagnostics and therapeutics come for dogs.
Yeah. Oop, there you go.
Uh-oh.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline. Medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started. Hi, this is Dr. Susan Little.
And Dr. Jolle Kirpensteijn, and this is the Purr Podcast.
And we have a repeat offender.
We have a repeat offender, and we're super happy to have her here, because it always means that we'll have interesting discussions and a lot of that.
Thank you for having me. Love you guys.
You're welcome. We were just trying to figure out
what we're going to talk about.
And I'm going to have to look up the number of your... Have you done like one other taping?
Only one other.
What?
Maybe two.
It's her fault.
We did 2 back-to-back episodes.
Yeah, but that's,
we were being very
that's normal.
It was back here. I think my hair was curly.
There's another reason that this is a special one, not just because we have Dr. Sue Ettinger back with us, but we have a special guest. Yeah, we have a special guest.
I know, who keeps distracting me.
And nobody else has ever been on our podcast with a special guest.
No,
you are number one.
Yeah.
Wow.
This is a complete unicorn. And because
I don't believe that.
we cannot say what this special guest is, because that's forbidden on this podcast.
You can use his name.
You can only say Chippy. Hey,
That's
Chippy,
right.
come here. Let's sit. Let's show everybody.
I forgot that the D word is.
No, the D word is
Look
not
at
allowed.
that.
That's it.
I just asked how much he weighs, and he weighs half a cat.
Yeah.
See, I can say that.
Yeah, he weighs half a cat, and he is.
He's very cat-like.
Yeah, he's like a little cat.
Yeah,
That's
and
what I
he's not anything that begins with D. So
No.
because we don't allow that here.
No, I know. I think I got bleeped quite a few times the last time.
Yeah,
And you know that it is every time you do it, it's a bottle of wine.
it started
has
as a glass.
increased.
So we
I know.
moved up.
Has
Inflation
increased.
in the last couple of years.
It's just like eggs. It goes up. It doesn't come
What's
down.
with the eggs? The eggs. Yeah.
bird flu.
Yeah, it's bird flu.
Oh, duh.
I don't know.
Okay.
Dr.
We
Susan.
may have to start requiring a treat for our non-D guest. Like, so instead of wine for us, we may have to say, okay,
I was just hoping for a cup of coffee.
I was just, where is this going? But now,
Okay. Follow along.
Yeah, we're talking about cats. Susan, that's what this podcast is about.
Anybody?
Thank
No
you,
idea.
Dr. Sue here.
Yes.
And we have so much to talk about.
Yes.
And I have no idea what we're talking about, so let's.
Let's do cancer.
Oh, thank goodness.
I wonder
Thank
where
you.
it came from.
Right.
Well, that's a good
Right.
thing. I know nothing.
Cancer.
Wait.
Yeah, wait, yeah. That's just aspirin.
Yeah, but no, we're not going to aspirate.
Why?
Please.
Don't wait.
Don't
Why
aspirate.
wait?
Oh,
Don't
why?
aspirate.
Okay.
Why wait? Aspirate.
Yeah.
Don't aspirate. That's what I'm trying to change.
Right.
We
Okay.
want people to
Okay.
aspirate.
Okay, I'll get
Dr.
it right.
Susan messed up their whole 10 years of building this brand.
I know.
No,
Right there.
I had a different kind of aspirate in my mind.
What kind of aspirin did you have in mind?
The one that lands you in the hospital.
Aspiration pneumonia, you mean?
It could be.
Dr. Sue, how are you doing?
I'm fantastic. How are you?
I just want to know, you just came from Japan. What did you do there?
Yes.
I spoke on the Nucleosome-based cancer test, which is unfortunately only for a different species, but they are working on cat version. So that
actually is a subject I wanted to ask you about. So we'll get into
Okay.
that in a minute.
So it's not launching, they've had it, but they're promoting the test in Japan. So I did a lunch talk at the Japanese College of Veterinary Internal Medicine.
Nice.
And then I did an evening talk for a group of young veterinary professionals that meet once a month. And we talked about the highs and the lows of your career. And it was really honest and amazing. It was a fantastic experience. And I did some sightseeing and shopping.
Where did
and
you
eating.
go for sightseeing?
I was in Tokyo for 5 nights, and then I went to Kyoto for 2 nights.
Wow. So 7 days for 2
9
lectures?
days.
Oh
Yeah.
my gosh.
Yeah.
She was
Who was
telling me.
getting these
I know.
gigs,
She was telling me. And then I
The
told
vacation
her what
part was my part.
Oh, okay.
telling her what my trips to Japan look like.
I just want to say,
But I've never been there before, so I wanted to see it. So I hired a tour guide, and it was
that's
great.
nice.
Yeah, so I
Yeah.
could just enjoy the experience without having my face in my phone and trying to figure out where I was
We
going.
had a tour guide in Japan once. That
Japan is amazing.
the young guy who I think he has probably PTSD after spending.
Oh,
Lovely. What was his name?
yeah, we're not going to say name on the podcast,
Okay,
but
lovely
but,
fellow.
amazing. But we were totally into that game, remember?
Oh, was that Pokemon?
Yeah, the Pokemon game.
Oh,
It just came out.
right.
And we were chasing this whatever
Yes,
yellow thing, whatever
yes.
he's called.
Pikachu, I think.
I think
Pikachu,
that is,
yeah.
I don't have any of them.
And
My
the
kids were
thing
never into
is,
it.
I mean, he was the hottest commodity in the whole game. And we got all these warnings like Pikachu is at the temple. So instead of us looking at the beautiful temple, that sort of thing, we were on our phone finding that freaking Pikachu.
Now, mind you, everybody else around us was doing the same thing.
Yeah.
Because it was a thing at the moment.
It's crazy.
Yeah.
Crazy. But
I forgot about that.
Japan is beautiful. It's a lovely country. Food is delicious.
Yeah.
So you had a lot of sushi.
I ate a lot of sushi, a lot of ramen, a lot of
And
goodness.
it's better in Japan.
Everything's better.
And they love cats. And she went, oh my gosh. So here's a story you have to tell.
So I went to a Capybara Cafe.
Capybara Cafe.
So there was one large capybara, which is basically just a beautiful, clean rodent. And I don't like the rats in New York City, but this, and you go and you feed it. You spend 45 minutes. They just like cycle you in, and all these beautiful. There was one short-haired cat. I felt so bad for it because all the other cats were
like
long and beautiful,
well-groomed.
and then there was like the little orphan stepchild, like the little short-haired cat. But you go and you got to feed the capybara and play with the cats for 45 minutes.
Okay, why the combination?
I have no idea. I wanted to see the capybara. One of my colleagues was over for an oncology meeting last year. She was like, you have to go to the Capybara Cafe. And I was like, but it's a big rat. She's like, just trust me. And I went, and you get to feed it. It's sort of like a docile Labrador. It's like, just eats.
Well, the interesting thing is I knew that there were capybara cafes where there's multiple of them. Yeah, it's on online all the time.
Yeah.
And then they feed them carrots.
We were feeding them grass, like a little cup of grass, and they eat 8 pounds of vegetation a day.
Yeah, I bet, because they're really big.
Yeah,
they're like
big.
as big as a D.
I
think bigger than a D.
I think in bulk, you know.
So I just want to know what kind of do they have the little round thingies that come out from the back, or are they? Do you know?
Oh, in other words, is it litter trained?
Poop?
Is it litter trained?
It didn't poop in the 45 minutes I was there.
You know, I wonder about that.
It was very clean, and
I think they're very clean.
Yeah,
it looked clean.
Did they take it off site? I mean, we're in the middle of the city. Hopefully, it got to swim. It has like webbed feet.
Yeah.
Oh.
So hopefully it got to go swimming.
How do you just make it swim in Tokyo?
You
didn't ask those questions.
In the next podcast, I will have more research on capybara.
Okay.
Quality of life.
So the second question is, why the cat capybara combination?
I don't know.
Because you would think that the bigger cats are probably the aggressors to the capybara, and the little cats.
They didn't seem to care.
Yeah, when the capybara came down, when everyone got to feed it, the cats just kind of moved out of the way. But there were some cats just sitting
like sleeping on a
shelf
above
it.
No, like on the little cat towers. It was a symbiotic.
Yeah, like you couldn't tell if you didn't see the capybara in the video. You would not know anything else.
The interesting thing is that the cat cafes in Tokyo are amazing. There is this one cafe that is looking over this very famous square, and the cats. I mean, it's just. Like I said, it's all clean, and beautiful, and quiet, and nobody's screaming. And
everybody's
wonderful.
very well behaved.
It's wonderful, and you have to take off your shoes and put little shoes on. And some people wear gloves.
You have to wash your hands.
Very careful.
And they keep the cats really well groomed.
Capybara Cafe.
I know.
Capybara Cat Café.
Maybe we should do a capybara podcast. One episode. Hey, that's a good idea. Let's get an expert on capybaras.
I think you guys should you should go on the road and go to Japan and film at the Capybara Cat Café.
I just want to know if there's a vet online that hears this and is an expert in capybaras. We would love to have you on the show.
Yes, because we have questions.
We have questions. We have many questions. And my first question is combination cat capybara.
Yeah.
It doesn't make sense, but you know?
Hey,
The tourists were
It's-
there.
No, I think it's probably easier to get cats than capybaras, don't you?
Yes,
Right.
I think so. But why they decided to put them together, I don't know.
oh,
And probably
gosh,
to have a little bit more.
gosh.
Because if you only say, how many people were allowed to get into that cafe?
At a time, 10, if
Yes, so you have 10 people and one capybara. That's not really doing
that. No,
it.
so they got to play with the cats during the cat.
Distraction.
Yeah, see?
It's a
No.
anything about cancer in capybaras?
No.
Why not? You didn't look it up. I would read it.
I did learn that they eat 8 pounds of food a day,
Yeah,
so that's good. I thought that, I didn't know that we were gonna be talking
Yeah,
about the
we-
capybaras.
We
I thought we were gonna-
never tell our guests in advance what the subject is because usually there isn't one. But in
I
this
know,
case,
which made me a little angsty,
we
by the way.
wanted to see your like natural reaction
It-
to learning it's about capybaras.
The reason that this
I could've done
podcast
more
is so loved is the fact that we don't have a script
No,
and we don't do the blah 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 blah.
No.
We hit the real topics.
it's hard. You know, we hit hard.
And
All right, I
We
know.
go right. We
So-
go
I
right
know,
to
what types of cancers
So-
do the
capybaras get.
No, but I mean,
memory cancer?
it probably.
Good guess.
I would say.
I mean, because rats get,
Oh yes.
Perfect. I'm going to ask ChatGPT.
Oh,
Okay, you go talk. I'm going to do a little research right here, live for our audience.
so as a cat vet, over the last few years, I've noticed that on the other side,
yep, I know.
there are these tests and treatments popping up.
Yeah, I
Right?
do. I have always felt this way, that cats are the like neglected stepchildren in oncology.
Yeah.
There's less cancer, but
Yeah.
I feel like in the last 5 years, there's been maybe not an explosion, but there's been so many diagnostics and
Yes.
therapeutics come for dogs,
Yeah.
Oop.
Oop, there you go.
Uh-oh.
And
for
your
the other species.
Bleep.
But you're making me talk about it.
You
But
can
I
say
do.
canine.
Oh, I can?
Yeah.
Okay.
Do we want white or red?
Do I get to share it with you? Or does I have to give it
of
over?
course, of
Okay.
course. And I sorry to break you off, but
Oh, here we go.
capybaras do get cancer, by the way. Although there's not a huge amount of published research specifically on cancer in capybaras compared to
Shocking.
more common companion animals like geese and cats.
These
The
cats.
reported tumors come from zoo animals, which makes sense. Skin tumors like squamous cell carcinoma, especially in areas exposed to sun, which makes sense.
But they're pigmented.
And they live in areas with a lot of
Orbital tumors are occasionally described in capybaras. Reproductive tract tumors
Oh, there you go.
I wonder if
There
I
you
could
go.
use Stelfonta in a capybara.
and
See?
internal organ cancers. Yeah, that's a little.
You
thing.
can't use that in the
You know
sea.
how long they live? 8 to 12 years.
Do they?
I was gonna guess
Yeah, in
less.
captivity, and they're prone to some of the same age-related diseases of mammals.
There
Very
you go.
nice.
All right.
Do you want me to dig up some specific case report or papers? Yes, please.
So,
Okay.
while you go do that, we'll,
Oh, but let's go back to. Sorry, that. This is just to finalize our capybara.
Yeah.
it is, and
story.
you know, you never know where things take weird turns when Yola's in the room.
Let's
Let's just touch briefly on, like, as you say, the last 5 years, what's been coming out on the canine side, and could it come to the feline side, or maybe it can't because, so I'm just kind of interested. Where
So
could we go with those?
for screening diagnostics, right, that's a huge area of
It
interest
is.
right now. This is a brand name, but it's okay. Okay, Canine was for that. So that was a screening
Oh,
test.
you can say canine.
No, I know, I
As
can.
long you cannot
Yeah.
say.
But that was from Pet DX, but they have gone out of business. So
Okay.
that was a cancer screening test. It was a genomic test, and it picked up lymphomas, hemangios, and osteos, and a bunch of other cancers.
So this is like on a blood sample.
on a blood sample.
Okay, and it's looking
It-
for markers, I guess.
yeah, and it was very expensive. Was one of the reasons I think it didn't take off. NuQ measures nucleosomes, which are pieces of DNA that are released in certain cancers and when there's inflammation. So it's a healthy screening test.
Okay,
It's an antibody test. It's an ELISA test. So they've been working, is what they told me, on a cat version of it, because that would be great, right? Because cats are such hiders of their disease.
yeah.
If you could find it. So that's not available yet, but I can tell you Volition has told me that they're working on it, but it's been a
Okay.
couple of years.
And so it's an antibody test to nucleosomes.
Yes.
But it's not, is it specific for a type of cancer, or
No,
it's just
it's usually the systemic cancer. So in dogs, it picks up
involved?
in
White and red, I think. Yeah.
I'm just gonna buy a multi-box. I'm
Rose.
just gonna buy 2 boxes.
Yeah. Also,
So it picks up lymphoma and hemangiosarcoma. It picks up metastatic disease, but you have to run it in healthy dogs because if you have a dog if you have canine that's septic or traumatized, inflamed, yeah. So if they're having an IMHA flare up, would not be a good time. But if their immune mediated disease is under control, you can run it. So it's meant to be a healthy screening test when they're going in for their annual or semi-annual exam.
Like advanced
how much does
warning.
it cost?
The cost, so I use it in my practice. So we have a point of care one, and I'm in the metro New York area. It's $87 to the owner. So super inexpensive.
Yeah.
You can
So much better than the previous.
right. The other one was $500 to the owners.
Okay.
So it was very expensive.
So this you can have like a patient side
Yes.
test
Yes.
essentially.
Yeah.
Right?
And you get back the results in 6 minutes.
Yeah, yeah.
So super great. It would be great if you could run it in cats, but again, they're still working out, and the big question that people have asked is like, which I don't know the right answer, but we'll be able to distinguish IBD versus lymphoma. Based on what I know so far, I don't think so. But if it could pick up
chronic inflammation too. I mean, doesn't
well, I think
it doesn't do chronic, so you can have a canine, which is actually an adjective, not a noun. But anyway, since it doesn't get me in trouble here, you can have right the adjective. English is
no,
okay.
English is
So,
oh my
but
gosh.
you can have. Listen, I only speak one language.
This is verbal abuse right now. Okay, never.
I was going to say you can have a dog.
canine.
I didn't say the full word. I said dog. You can have a dog.
We'll give you
You
that.
can have one of those hairy species that has chronic otitis, arthritis, all those things. It doesn't.
Not an issue.
It's not an issue. Major inflammation. So pancreatitis.
Okay.
Hit by car, hemo abdomen, so things like that. So then you wouldn't want to run it. But so I think it could be really useful for cats, but again, we don't have that.
Do they have nucleosomes, cats?
Yes, we have nucleosomes. It's just fragments of DNA with a histone, and these fragments end up in the blood when there is sepsis, trauma, cancer. And normally, and they've done studies in dogs, and I think they're working on in cats. You asked me.
We need a little on-screen counter for you. Yeah.
You compare and contrast.
I'm gonna add an on-screen counter. Yeah.
Normal healthy canines, nucleosome levels are low. So anytime your cells are turning over, nucleosomes and people as well are released into the bloodstream, but normally they're cleared, but the system is overwhelmed. So there's one of these conditions, so you can find it. So
my follow-up question was then, so they have nucleosomes, but they're probably different than the D word.
I don't think they're different. I think it's the antibody is measuring them.
I'm asking Dr. Sue.
She's right.
Yeah, she
knows more about cats than I do.
She knows more about cats about the whole world. But still, she also knows that she sometimes has to slow it down a little bit.
Not saying anything.
Me neither.
Okay. So are they different or?
I don't think they're different. And I don't know how much
she said.
I know. I tried to let her talk. You were the one that didn't let her. There's another company that has a cancer screening test. So IDEX is about to launch.
Yeah, that's what I want to know.
But I don't know much about it. The press release didn't have information. I know it's only for lymphoma. I walked by their booth. They were doing a little presentation. I don't know if it's a PCR test or what it is, but it is only for the other species at this point. Like, why is there so much more research
and even product development, test development?
Yeah. So there's Laverdia, which is for canines, which is an oral lymphoma drug it's conditionally approved for dog for the other species.
Okay.
But
that's not a common tumor in cats, right?
Lymphoma?
Yeah.
I thought you said oral.
It's an oral drug.
Oh, I'm sorry. I confused.
Not for oral lymphoma.
Yeah, okay, gotcha.
It's an oral drug that's conditionally approved for canines.
Oh,
for lymphoma.
Okay. What kind? It's like
it's a sign inhibitor or sign drug.
Often we think that they don't develop these things because they don't think the population is big enough. So they don't sell as much. But if you look at your practice, how many cats do you see versus the
it is predominantly, and I go through waves
Mhm.
where I'll have a bunch of cats. So one point I had, they say everything comes in threes. I had 3 cats with mast cell tumor, 2 were splenic, 1 was gastrointestinal, and they all were kind of going through chemotherapy at the same time, and they all kind of graduated at the same time.
And then you won't see one again.
And then I won't see for a while.
So
I'm
that's
seeing right now I have more low grade lymphomas than high grades. I think part of it honestly also has to do with my wait time. So and so if I'm, I can't get them in right away for the high grade lymphoma. So I think that's
They
why,
can't wait.
they can't wait. But those are the top things that I'm seeing. But I don't know, 75, 25 for the other species to cat. It shifts. It just depends on the ebb and flow of the cases that are coming into the hospital.
Right.
But it's definitely, it's not as common in cats. There's less research going into it. I mean, even in the supplement world, because I just did a talk on supplements, cat owners will see my stuff and be like, why is there less for cats? I'm like, you're 100% correct. We have less supplements for them, less, and it's frustrating as, especially when you're looking, so it's lymphoma, right? Which is one of the top cancers that we see in cats.
Cats, I think it's the top 3.
Right. There hasn't been a lot of good research about, protocols to use. There hasn't been new drugs.
Especially with novel drugs like
Right.
the one for the other species that you just mentioned. Like we don't see any of that.
Right.
Is there less cancer on a population level in cats than in canines?
It's thought, yes, but as you know, there's no census, right?
Yeah.
And so we don't know how many of the other things and cats there are in the US and Canada.
So,
And then cancer is not a reportable disease, and people it is. So in people, it's really interesting. You can go on different websites like NIH or whatever, and you can see, and I don't know if they update it every year, but every couple of years, you can see what the top 5 cancers are in people, and you can see it among race and ethnicity and like really break it down for within the individual cancers. I always feel like we're so behind because
there have been attempts at cancer registries, right? But they're voluntary.
Right now, but it's also for the DI.
Is it?
Yeah.
Yeah.
That's
So again,
just always made me wonder, like if you don't look, you don't see it.
Yeah.
And by the way, we are at time. So then next time when we come back, we will keep on talking about this.
Yes, because I still have questions.
Do you have a
About capybaras?
Do you have a cliffhanger? Oh, wait, yes.
Here we go.
Yeah, thank you for
I
saying
guess
that,
we have to
because
end on a capybara
yeah,
note.
because there's the research just came in.
Oh.
So there was one
Oh,
4-year-old male capybara with a squamous cell carcinoma on his buttocks. So that's why after chronic dermatosis, which probably has nothing to do with it, but that's okay.
That's chronic inflammation can lead to cancer.
Right,
sarcomas.
a leiomyosarcoma with metastasis in a 10.5-year-old female capybara.
Well, she's old.
Chronic weight loss and a uterine mass,
Oh.
a uterine leiomyosarcoma. Oh, kind of the same thing.
Yeah.
That's interesting.
If this whole other species and cat oncology thing doesn't work out, you can go to capybaras.
But it's interesting. And then the last one is a
friendly.
plasma cell neoplasm and a uterine fibroid. I remember something with rats. If you spay them, they
If you don't spay them.
don't spay them.
Yeah.
So because it's a
And I can say that because I have spayed rats.
right.
Mm.
But I mean,
I don't know.
there's probably something with the uterine tract that becomes malignant.
Very good.
When they get really old.
What do you think, Chippy?
So that's the latest news on capybaras.
Yes.
Thank you very much for joining us at the Purr Podcast. What sound does a capybara?
Oh, yeah.
They just ate.
So I guess it's like chomp.
Yeah.
Chomp.
And then she would put her head back and like kind of show her teeth and like yawn. It was really cute.
Oh, really?
But her teeth are just these like almost like bunny, like big
Oh,
incisors.
really?
Yeah, I'm thinking of the name for the chomp cat. Yeah.
I wonder how long it's going to take to get Yola off of the capybara.
Oh, this is the Purr Podcast where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.